The evolution of breast cancer treatment has really turned into a revolution thanks to innovations in surgical techniques. And joining me today to talk about this is Dr. Nancy Taft, and she is Medical Director of the Comprehensive Breast Care Program at Jupiter Medical Center. Dr. Taft, thanks for being with us today.
Well, thanks for inviting me.
So tell me, when a patient is diagnosed with breast cancer, when should they be getting to a surgeon?
Actually, when a patient first finds out about their diagnosis, the person that they should see first is the breast surgeon. The breast surgeon really is kind of the captain of the ship, a multifaceted team of physicians. And it's usually the breast surgeon who explains to the patient about their diagnosis and some of the intricacies and starts talking about the treatment.
So do you see your role as a breast surgeon really to be an educator at the part of this whole odyssey for a woman?
I do. I think that's really an important piece. In fact, I had a patient come in today and thanked me for breaking that down, because all the subsequent conversations she's had with other physicians in the team, she said they were much easier for her to understand because she already had kind of a baseline of which to work from.
That's great. So let's start understanding breast surgery. There are two basic types of breast surgery, right?
Yes, one of them and even those types are intricate, but to break it down to the basics, one is a lumpectomy, and that's where the tumor is removed for the breast. We actually call that breast conservation because we conserve or save the rest of the breast. The other is a mastectomy. Now there's several different forms of mastectomy, but mastectomy was in all the breast tissue. Not quite all, because we do have to leave a couple of millimeters of breast tissue underneath the skin to supply the nutrients and oxygen to the skin. But the rest of the breast tissue is removed. And then there's the issue of what type of mastectomy, and then whether patients are going to have reconstruction and the type of reconstruction. So actually those conversations seem pretty simple on the surface, but they can get very complicated.
So when is breast conserving surgery appropriate, and when really is mastectomy required?
Well, there certainly are times that patients can have a choice in this, and we like to offer patients a choice so they can have some say about how their breast looks and what they're going to go through with their treatment. So we like to offer them that. Sometimes we can't do that. So to be a candidate for breast conservation, it depends on the ratio of the size of the tumor to the size of the breast. And it also depends on, do they just have one breast cancer in their breast, or do they have two different nodules or two different cancers in their breast? What's the proximity of those nodules to each other? And also, do they have, for instance, a nodule that's maybe close to the chest wall? And sometimes it's an issue of, cosmetically, can we remove the tumor from the breast and still make the breast that's left behind, make that breast look nice?
You just said cosmetically. Cosmetic results are so important to breast cancer patients. Obviously, they want to cure their disease. They also want to feel whole again. And I understand that there's a new procedure called hidden scar surgery, and that you're certified in this. Can you tell me what that's about?
Yeah, this is really a true passion of mine. I really feel strongly that these ladies have already been given this diagnosis of breast cancer. There's certainly a conversation at some point that goes on, am I going to live? And the second conversation comes along is, what am I going to look like? And I really have a passionate kind of a journey here that I want to take that scar and place it strategically in a place that maybe they won't see it. Now, the places that we actually can put that scar to minimize that is in the inframammary, the underside fold of the breast. We can sometimes do it through entering through an incision underneath the arm, where we would be checking the lymph nodes there anyway. And sometimes we can extend that incision that we already are going to make and get to the upper part of the breast there. Or sometimes we can make an incision between the border of the skin and the areola, and we get the cancer out that way. So when we close these incisions, over time, these incisions will fade and you will not see that. We can also, I always tell patients, through this little bitty incision that you have in your breast, we're moving a lot of tissue around, because when we take the tumor out, this leaves a space. So we do what we call kind of advancement flaps in there and take the breast tissue and kind of rearrange it to kind of fill that gap. So when that closes, the breast looks symmetrical and full, just like the other one. And then you allow some time to elapse and that incision fades. And I tell you, one of the most gratifying things for me as a surgeon is when they come in several years later and no one can find their scar. And I really, a lot of times at the time of surgery, they don't act like they care about that at the time because they just want to live. But later on, they're really grateful that they can't see it, because when you do, it's kind of a daily reminder that you've had cancer. And that's not something I think any of them need.
So you think really, or you've seen with patients, that the scar kind of carries a psychological weight?
Sometimes it does. Now, sometimes it's a badge of honor, and sometimes it's a sadness. That scar means different things to different people. But I'd like to place it strategically because they have to look for it and they don't necessarily have to be reminded of it.
Are there some women who are appropriate for hidden scar surgery and maybe others aren't?
Yeah, there is. I mean, I would love to sit here and tell you that we can offer that to everybody. It's definitely a conversation I have with patients in the room. Whether I think I can do it, what it will take to do it, what are the risks of doing it. So a lot of it's going to depend on maybe the size of the breast, the shape of the breast, and just maybe a patient's general wellness, because it's going to take a little bit more time, a little bit more anesthetic time, and maybe this isn't something that would be something safe to offer. So that's definitely a conversation that I really try to find out for them what's important to them and they understand what it's going to take to do that.
You said you need to understand what's important to them. How many times do you meet with a patient more than once before you end up taking them in for surgery?
Oh, multiple times. So I always see them the first time. It's certain people can handle a large volume of information at first, and some people cannot. And it really depends on how new the diagnosis is and the emotional attachment and kind of their support system, what's going on. So in the very beginning of the meeting, I kind of say, okay, let's see what we can cover today. And sometimes these meetings, we may only talk about one or two things. So sometimes we get through it all. It depends on what we're able to cover. But then I sometimes bring them in a couple more times, and I like to use the phrase that they kind of have to be with it a little bit. The shock kind of wears off a little bit, and I always encourage them, let's make decisions today. So my job is to empower them that the decisions that we make together are decisions that later on, 5 years from now, they're going to be glad that they made. So that takes several times, and I'll see them back as many times as I need to see them back, and I can tell you that some of them, I'm on the phone with them sometimes as much as 2 or 3 times a day, until we get to a place where they're in a better state of mind.
That's wonderful. So I understand there's some other exciting developments beyond the hidden scar surgery, and at Jupiter Medical Center that you all offer something that combines radiation at the time of surgery. Can you tell me what that is?
Oh yeah, this is really actually quite an exciting time, as you said, for Jupiter Medical Center. So certain patients, again, qualify for intraoperative radiation. Now there's 2 different kinds of radiation. One is called a single fraction, which means the patient comes in, they have their tumor removed, so this is a lumpectomy. We're conserving and saving their breast. And while we're doing that, at the same time when they're asleep, they get their radiation. So single fraction means 1 dose of radiation, and we close the incisions and they leave and go home that day, and all of that part of their treatment is done. Some patients don't qualify. We have a kind of a criteria or protocol on what patients qualify for that. Some of them will qualify for what we call is a boost dose of radiation. So typically a standard whole breast radiation treatments are 33 treatments. So the boost dose may drop those number of treatments by a week or 2. And then Dr. Odessa, our radiation oncologist, he makes that determination what he thinks is safe and appropriate. So between those 2 techniques that we have, really minimizes their treatment afterwards. And the other thing I want to say about that is, when I was telling people when I first got here, is that means because we're delivering radiation and we have to be hooked up to a machine, that incision on the breast is a longer incision and traditionally has been placed over the top of where the tumor is. So that kind of goes, against this hidden scar surgery, minimizing, the scarring and, making the cosmesis, the best that we can. So Dr. Odessa and I have really taken this on, that we want to use some of the techniques we use in hidden scar surgery and use that with the intraoperative radiation. And we have done several cases that we've had absolutely beautiful results, and we're happy with that, and we just continue to make that better and better.
So really you're combining these 2 techniques to try and provide the best result for the patient.
Yes, in fact, there was a lady I just saw here about an hour ago that came up to me. I was walking down the hallway and I did her surgery. She was intraoperative radiation, single fraction, and I did it through the incision underneath her arm I used for the lymph node. Dr. Indessa and I were used to use an angled shaped cone to deliver her radiation, and she was telling me how excited and grateful that she was that she has one incision underneath her arm that she already can't even see.
That's wonderful. And now, are there just certain women who can have this intraoperative radiation procedure?
Yeah, we have a protocol here. So we have certain features about their cancer, their age, that we can offer safely. So I encourage anyone who has the cancer to come in. We'll sit down and talk with them, explain what the options are, and see whether they meet the protocol.
And you were mentioning that they could have this single fraction or perhaps a boost. And it sounds like one of the main benefits to this is the fact that they can get back to their life so much more quickly because they don't need all of this follow-up treatment and radiation. Tell me a little about that.
That's true. I've had them go home. I had a lady I just operated on the other day. I did her surgery on Friday. The next day, she was up on Saturday fixing, a nice full dinner for her entire family who was visiting out of town to take care of her. So she was back to her normal routine in a couple days. So it definitely, from a lifestyle standpoint, has a huge impact on their ability to kind of get on with their lives and put it behind them.
So is this type of treatment available everywhere, or is it, just in certain medical centers? Is it unique to Jupiter Medical Center?
Well, Jupiter Medical Center definitely was the first person, or first facility, I should say, in Florida to offer an intraoperative electron, and I stress electron radiotherapy to patients. We're the first ones here, and we've done the most cases. So there are others that are starting programs in other places, but we so far have the largest number of volume and the most experience.
So we've been talking about options in treatment, and obviously women need to do their research. What sort of research should they be doing when they're trying to select a surgeon?
Well, that's really interesting. And I have to say, people today with the internet and social media, people today are pretty darn savvy with this. And even if they're not real big computer people, their families are. So there's always someone who's doing the research. So I think, first of all, to look at where your physician went to medical school, where they did their training, what type of training they have done, how many years they have been practicing medicine. Also, a lot of times you'll see different blogs that patients will make comments about their experience of working with a doctor. Again, that's just a perspective, but that's something you could consider. I think the main thing, though, is to really look at their training and where they've trained and what they've done with that training.
And what type of training should they be looking for? Obviously, for people not in the medical field, it's hard to know. There's, residencies and fellowships, and what should they be looking for?
Well, as you know, I'm a fellowship trained breast surgeon, and that, is something here at Jupiter. We've also hired Dr. De La Cruz as a fellowship trained breast surgeon, and both of our imagers, both Dr. Hadar and Dr. Fry, are fellowship trained. So the big thing is, well, what does that mean? So what fellowship means is after we've all completed our residencies, that we have gone on to do an additional year of specialized training in just this field. So I did my fellowship at Northwestern, where it was a breast cancer fellowship, and so I did over 350 cases in 1 year, and that's all you do for that entire year. So when you graduate, you have the most up-to-date techniques. You've also spent time on medical, like myself, on medical oncology or radiation oncology, so I have experience with those things. So for instance, when people come to see me, I can talk to them about their possibility of chemotherapy, and they'll say, well, what kind of side effects and how long? And I can talk to them about some of the things that are possible. So I'm very grateful for my fellowship. I was a general surgeon doing breast, and now I'm a breast fellowship trained surgeon, and I can tell you the difference is huge. So I think going forward, asking doctors about their training, and I also think finding out about, do you feel like you have a good rapport with this physician when you go to see them? Do they listen to you? Are they interested in what's important to you? Are they offering you safe options? And if they're not, are they explaining to you why those options are not safe or appropriate for you? And I think a lot of the times too, I tell patients this is a long-term relationship. So that relationship has to work.
That sounds like good advice. Since you went through your training, your time in fellowship at medical school, have you seen a lot of changes in breast surgery?
Oh yes, and you know, there was I think last year there was 11,000 articles published on breast. So that's one of the things I really love about being a breast surgeon is that's all I do, and it's a full commitment. And so we see new studies coming out with new recommendations. We see new technology come out. You also want to be really smart about these things because sometimes the technology's has come out, but it's really early on to know if these are safe options for patients. But I've seen a real trend. You kind of see the pendulum swing between breast conservation, which is what the big trend was when I got out, and then with the Angelina Jolie effect, we have that pendulum has swung towards a bilateral mastectomy. And so what I'm really passionate about is that we are able to target therapy according to what is best for you. So we can look exactly at the patient, what is best for them about their cancer, and it may be different than their neighbors or somebody at work. So it used to be we treated pretty much everybody fairly consistently. If you had a certain size of tumor, we did this, but that day has changed. So we have tests that we can look at the genes and their actual tumors, and this will help us target on what we think is the best treatment that's individualized for them.
It does sound like you offer personalized care. Why is that important to a woman's outcome?
Well, it actually is what drives the whole thing. I mean, the biology of their cancer is what is going to drive their chance of either recurrence or a new breast cancer. And not understanding that biology and not targeting it appropriately really renders their treatment less effective and puts them at higher risk. So it's really important to have a multidisciplinary approach. The day of the surgeon seeing the patient and operating on them without including the other physicians is definitely over. And it's so that we can all sit down and review the case and make sure that it truly is comprehensive care.
And as medical director of the Comprehensive Breast Care Program at Jupiter Medical Center, how have you worked to assemble this comprehensive team?
Well, this team, a lot of these physicians and things were in place. I have to say about Jupiter is that I say that we always have the beautiful buildings, we have the best equipment on the market that money can buy, and we have some of the smartest physician and ancillary staff. So my arrival here was just a matter of how can we pull this all together. I really want to take this program, and I'm working very hard on taking this program from being what's maybe best for us as physicians and our schedules to making it patient-centered and doing what's best for patients. And so we're all committed to that, and it really means sometimes changing how we do things, but we're all on the same page, and I continue to see this program grow and evolve.
Wonderful. Dr. Nancy Taft, Medical Director of the Comprehensive Breast Care Program at Jupiter Medical Center. Thank you for joining us.
Thank you, Kathleen.